Hey guys, it's Brenda here with another video. I've had a lot of questions recently about how I found my cancer, and this video is going to answer those questions as well as give you a current update. I hope you enjoy. In 2011, I had a yearly visit with my gynecologist. During that visit, she did a breast exam. During that breast exam, she found lumps in my right breast. She immediately sent me for a breast ultrasound. The results came back from the ultrasound, and all of the lumps were labeled as tumors. I was immediately sent to a breast surgeon who did biopsies immediately. When the results came back, it showed that all of the tumors were not cancerous. I followed up with my gynecologist 90 days later, who did another breast exam. During that breast exam, she found even more lumps in my right breast. I again went for an ultrasound. It showed that they were all tumors. And again I was sent to the breast surgeon who did biopsies that day. Again, all of the lumps were not cancerous. This continued for a year and a half. Eventually, I had 22 tumors in my right breast, and all of them were not cancerous. Fast forward to 2013. In March of 2013, I was diagnosed with systemic lupus. Systemic lupus is an autoimmune condition with no cure. My rheumatologist started me on oral meds right away. My disease progressed and caused permanent damage to my heart. Now my aortic and mitral valves are leaking blood. After that, my rheumatologist said I needed to start low-dose chemo, and I needed to have a port put in my chest. My port was put in, and I started the low-dose chemo through my port. Fast forward to 2015. In August of 2015, my family and I went on a vacation to Panama City Beach, and we had a great time. We came home on a Sunday, and I was feeling sick. The next day I was feeling even worse, so I texted my boss and I told him I would work from home. I knew that I was dehydrated, so I started an infusion of fluids through my port. I suddenly became seriously ill. I texted my boss and told him that I needed to get to the hospital and that I would explain later. I also called my husband, but I could no longer talk. He was at work and was extremely worried, so he called 911 to our house. I was rushed to the hospital by ambulance. When I got to the hospital, they told me that my port was infected from being in the ocean. They also told me that my port is connected to a vein in my chest that runs directly to my heart. They also let me know that when I started the fluids, I pumped the infection in my port directly through my heart and through my entire body, making me septic with a 104-degree fever. I was immediately taken into emergency surgery to remove the infected port and to start antibiotics. When I woke up from the surgery, I noticed that there was a lump just under the incision from removing the port. I let the doctor know when he came in my room, and he told me that it was probably from the surgery. 2 weeks later, I had an appointment with my gynecologist. I told her that they messed up my surgery and that there was now a lump underneath the incision on my left side where they removed the port. She decided, just in case, to send me for a mammogram. After the mammogram test, the doctor who did the test decided to sit down and speak with me. He told me that everybody who has a lump automatically thinks they have cancer. He also told me that I was too young to have a mammogram. I asked him to look at my pictures anyway. He threw them up in front of the light, said, "Yep, just thick tissue," and pulled them back down again. He told me that I didn't need to return for a mammogram until I was over 40 years old. 1 week later, I followed up with my gynecologist, and I let her know what happened at the mammogram. She was very uncomfortable with his result, so she sent me to the breast surgeon who I had seen so many times previously. The breast surgeon, of course, did a same-day biopsy. She said that the tumor on the left side was probably the same as all of the tumors on the right side that were not cancerous. She told me that I probably didn't need to worry about this at all since it was probably just like them. 3 days later, the breast surgeon called me and left a voicemail. I listened to her voicemail a little later, and she said that I needed to call her personal cell phone. I called her back when I was driving home from Nashville. She said that I have the results of the lump on the left side where they removed the port. And then she told me I have breast cancer. I said, "Are you sure?" Because we thought this was no different than all the tumors in my right breast. And she said she was positive. I held it together and I said, "Okay, thank you." As soon as I hung up, I lost it. I called my husband on the way home. And I let him know the results. I couldn't stop the tears. I told him that I was okay and I would be home soon. I also called my best friend on the way home and let her know. I told her I didn't have many details at this point, but I would keep her informed. A couple weeks later, I had an appointment, the first appointment with my oncologist. My oncologist was with Tennessee Oncology. In September, I had a double mastectomy with tissue expanders and alloderm. They also removed a lot of lymph nodes under my left arm, if not all of them. They gave me a couple weeks to heal after the surgery. And in October, I started my first chemo treatment. My last chemo treatment was in March. I had a small break. And in April, I started 6 weeks of radiation. I finished radiation in May. At this point, my stage 2B cancer that had spread to my lymph nodes was listed as cured. The next step in the process was to begin hormone treatments. This was an injection that I needed on a regular basis at my oncologist's office. I did those injections through June, July, and part of August. In August, I began vomiting excessively. I called my oncologist and she suggested that I take anti-nausea medications on a scheduled dose rather than as needed. This didn't work at all, and I ended up calling my oncologist again. She told me that the chemo that I received and the treatment that I received was very strong and aggressive, and that the chemotherapy could stay in my body for up to 1 year, making me very sick. So she told me that I just needed to push through. I attempted very hard to push through, but I was unsuccessful. I called my doctor again and I said, "I'm vomiting so much and I'm now dropping a lot of weight." At this point, she decided to order scans. It's unlikely for cancer to spread only 90 days after treatment, so she didn't think that the scans would turn up to find anything. The results of the scans came back and showed that there was a tumor, a cancerous tumor, on my liver. So it was time to go to a specialist and have a liver biopsy done. At first, they attempted to do the liver biopsy while I was awake, but it was unsuccessful. They were not able to get to the spot that they needed to get to in my left lobe, and it was so painful that at one point I was screaming in pain. They rescheduled the liver biopsy, and this time they scheduled it with an anesthesiologist. This worked a lot better. We were hoping for, we were going to get one of two results from this scan and the liver biopsy. I was either fighting breast cancer and liver cancer, or the other scenario is that my breast cancer had spread to my liver, which would make me now fighting stage 4 breast cancer. The best of the two was that I would be fighting breast cancer and liver cancer because I would still be listed as curable. If the biopsy came back and showed that I was fighting metastatic breast cancer that had spread to my liver, I knew that I would now be terminal. The results came back and showed that I was fighting stage 4 breast cancer and was now terminal. In September, I had what's called a liver resection, which means they remove part of your liver. They went in and removed part of my left lobe. After this, my doctor put me on IV chemotherapy, very aggressive and strong IV chemotherapy, and I would be on this for as long as possible. After being on IV chemo for quite a few months, I became what they call stable. Being stable means that you still have your tumor, but it's not shrinking and it's not growing. After being stable for quite a while, my doctor decided that I needed to get put on oral chemotherapy because it was safer than IV chemotherapy. This oral chemotherapy that we tried at first had horrible side effects. It caused the skin on the bottom of my feet and some on my hands to completely peel off, leaving my feet raw and bloody, and some parts of my hands raw and bloody as well. At this point, I was pretty much bedridden, and it was way too painful to walk. My doctor did try other oral chemotherapy medications, but my body just wouldn't accept them. In August of 2017, I found yet another lump in my upper left chest. I tried to wait for my upcoming appointment with my oncologist, but in just days, that lump doubled in size. At this point, without seeing my doctor and without tests or scans, I knew I was dealing with another cancerous tumor. At this point, my doctor put me on 2 IV chemotherapies at the same time. This was rough. I did a lot of sleeping and had lots of nausea. However, I was stable. I was stable for quite a few months, which meant no growth of the tumor and no shrink of the tumor. After a few months, both of the chemotherapies stopped working, and my tumor doubled in size. At this point, I was put on the most horrible chemo treatment I could ever have. In February of 2018, I started an IV chemotherapy and 5 weeks of radiation, both at the same time. I began sleeping night and day, and it was very rough, but it was so worth it because for the first time, we had a hold on my cancer because my tumor shrunk. After a little while, I was forced to stop the IV chemo. The reason I was forced to stop is because my oncologist had done some blood work. The blood work showed that my kidneys were at stage 3 kidney failure. At stage 4 kidney failure, normally kidney doctors start you on dialysis. Cancer patients can't have dialysis because it cleans out your blood, and it would possibly clean the chemotherapy out of your blood, letting your cancer run free through your body. At stage 5, doctors normally do or put you on a list for a kidney transplant. The Kidney Foundation has a rule that patients that are terminal cannot receive a kidney. I was extremely upset to have to stop the IV chemotherapy, the one chemotherapy that was working. At this point, my doctor needed to put me back on oral chemotherapy to give my kidneys a break from all the IV chemotherapy. In October of 2018, I had some scans. The scans showed that I am currently stable. There are no growth of current cells and there are no new tumors. So, I'm stable and I'll take that. My doctors told me not too long ago that as my cancer has shown before, it's only a matter of time before my cancer either morphs and can grow even with this chemotherapy, or I will become immune to the chemotherapy and it will no longer work, just as others have done before. At this point, there are no more high-dose chemotherapy medications left. My doctor did tell me that when my cancer grows again, that we could possibly try the one IV chemo that was working, but we would be taking a chance with my kidneys. Currently, my husband and I are scared. I recently called the specialty pharmacy and told them that I needed a refill of my oral chemotherapy. They let me know that they were out of the medication. I told them that I only had a few left, and they told me that they would be able to get the medication in by Thursday. I called my doctor just to let her know. I didn't think just 2 or 3 days would make a difference, so I was happy with that and told them okay. This past Monday was 1 week off of chemo. I talked to my doctors. She said that just a few days off of this oral chemo would be just fine, but a week puts me in danger. Now, I'm over a week and a half of no chemo. We're very scared. Just the other day, we learned that the specialty pharmacy finally has my chemo in stock. However, they told me that they can't ship it out to me. Apparently, there's a program that I have to sign up for, and the process can take up to 2 weeks. At this point, this program that I'm required to sign up for first is risking my life. I'm extremely scared, but I know God is good. I just want to tell all of you that God is always there, and He's going to help us through whatever troubles and trials we're going through. So I want you to always find the silver lining in everything, whether it's good or bad. And I need you to know your body. If I would have never asked about the lump that was underneath the incision after removing my port, I would have never known that there was a cancerous lump there, and I probably wouldn't be here today. And you need to tell your doctors about all details that are going on, whether they're small, large, or whether you even think if they're insignificant. If I would have never told my gynecologist about the incident at the mammogram, I would have never been sent to the breast surgeon who did the biopsy and found out that it was cancerous. So always know your body and always find the silver lining. Sending all of you lots of love.